Good Morning Washington's Women's Health Month Spotlight is sponsored by Fairfax Radiology Centers.
Well, we continue our series on the importance of spring screening today with Dr. Melanie Atkins from Fairfax Radiology Centers. And today we are putting a spotlight on lung cancer screening, which I didn't even know there was such a thing. So can you tell us a little bit more about it?
There is such a thing. Over 500,000 Americans in the United States actually have lung cancer. And the problem with lung cancer is it's often, by the time patients become symptomatic, it's too late, and it's often spread to other places in the body or other places in the chest. And so we have many, many years of data that we now know that lung cancer, many types of lung cancer are associated with smoking. And we know that we can do a low-dose CT scan and we can identify these lung cancers much earlier. And so it's very quick and easy. The patient comes in, they lay on the table. In a matter of seconds, we do this very low dose CT scan, and we can identify these little areas that may turn into lung cancer someday, and patients can be treated prior to having any more advanced stages, and it's curative.
Yeah, and this is why I love our spring screening series here, because myself and hopefully you're learning a little bit more things as well. Who is eligible to get a lung cancer screening?
Okay, that's a fantastic question. So actually the recommendations have recently changed. There's a U.S. Preventive Services Task Force that makes all of these rules. They go over the data, they look at all of the patients that are eligible, and they've recently changed it to anyone over the age of 50 or above who has a 20-pack year history of smoking. And so we kind of do some fancy math when we talk about pack years. We take the amount of cigarettes that you smoke in a day and the amount of years that you've smoked, and we multiply those together, and it comes up with that number. So for instance, if you smoke a pack a day for 20 years, that's 20 pack years.
Yeah. Oh, okay.
Yeah.
Interesting.
Yeah.
Now, people can still get lung cancer, though, even if they aren't smokers, correct?
Absolutely. So this screening program is really, it's generally just for smokers because we know that they have an increased risk. But unfortunately, there's certainly a smaller percentage of patients who are non-smokers that go on to develop lung cancer.
So again, the screening, so important, and it seems like it's a pretty easy and painless process to get the lung cancer screening.
Absolutely. It's very easy, it's quick, it's paid for by insurance, by Medicare, it's relatively inexpensive. And one of the important things that I think it's most important that we talk about this is because I think a lot of people don't know that it's available. So we really need to have the education. Actually, less than 15% of patients that are eligible for lung cancer screening actually get it. So it's really important that we get the word out and the education so that we can start screening these patients and diagnosing any possible risk of lung cancer earlier and be life-saving.
Yeah, and Fairfax Radiology has, the latest technology. So for people that maybe are interested in reaching out for a screening, how do they go about doing that?
So they can visit our website at fairfaxradiology.com. It's also really important for them to talk to their primary care doctors about it and discuss it with them. But we have lots of information on our website where they can learn more about lung cancer screening.
And we've got all of that information up on our screen. So important. I love our spring screenings series because, again, prevention is probably one of the most important things.
Yes, thank you so much.
Melanie Atkins, appreciate it. We'll have more of Good Morning Washington after this.